Risk factors. Excessive blood pressure has many risk factors, which includes age. The danger of excessive blood stress will increase as you age. Until approximately age 64, high blood pressure is more commonplace in guys. Ladies are much more likely to increase excessive blood pressure after age 65. Race. Excessive blood stress is especially common among humans of African background, often growing at an advanced age than it does in whites. Serious headaches, consisting of stroke, heart assault and kidney failure, are also more commonplace in human beings of African background. Circle of relatives. History. Excessive blood stress has a tendency to run in families. Being obese or overweight. The more you weigh, the more blood you need to supply oxygen and vitamins for your tissues. As the quantity of blood flowing via your blood vessels increases, so does the stress on your artery walls. No longer being physically active. Folks who are inactive generally tend to have better heart charges. The better your heart rate, the more difficult your coronary heart must work with every contraction and the stronger the pressure to your arteries. Loss of bodily pastime additionally increases the threat of being overweight. The usage of tobacco. Not only does smoking or chewing tobacco immediately increase your blood stress quickly, but the chemical compounds in tobacco can damage the lining of your artery walls. This will motivate your arteries to slim and increase your chance of coronary heart sickness. Secondhand smoke can also increase your heart ailment risk. Too much salt, sodium, for your eating regimen. Too much sodium for your weight loss program can motivate your body to preserve fluid, which will increase blood pressure. Too little potassium to your weight loss program. Potassium helps balance the amount of sodium to your cells. A right balance of potassium is critical for accurate heart health. If you don't get enough potassium in your weight loss program, or you lose too much potassium due to dehydration or other fitness conditions, sodium can building up for your blood. Ingesting too much alcohol. Over time, heavy ingesting can harm your coronary heart. Having more than one drink a day for girls and extra than beverages a day for guys might also have an effect on your blood pressure. If you drink alcohol, achieve this in moderation. For healthy adults, meaning up to 1 drink an afternoon for ladies and 2 beverages an afternoon for guys. 1 drink equals 12 ounces of beer, 5 ounces of wine or 1.5 ounces of 80 proof liquor. Pressure. High stages of stress can result in a transient boom in blood strain. Stress-related behavior such as ingesting more, the usage of tobacco or drinking alcohol can lead to similarly will increase in blood pressure. Sure. Persistent situations. Positive chronic conditions additionally may also increase your risk of excessive blood pressure, which include kidney sickness, diabetes and sleep apnea. Occasionally pregnancy contributes to high blood stress as nicely. Even though excessive blood pressure is maximum common in adults, youngsters can be at danger too. For some youngsters, high blood stress is as a result of issues with the kidneys or heart. But for a developing range of youngsters, poor way of life behavior, which includes a dangerous diet and shortage of exercise, make contributions to excessive blood pressure. Headaches. The excessive strain to your artery walls because of excessive blood pressure can damage your blood vessels as well as your organs. The better your blood pressure and the longer it is going uncontrolled, the extra the harm. Out of control excessive blood strain can cause headaches consisting of heart attack or stroke. High blood stress can result in hardening and thickening of the arteries, atherosclerosis, which can result in a heart assault, stroke or other complications. Aneurysm. Accelerated blood pressure can motivate your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it could be life-threatening. Heart failure. To pump blood towards the better pressure to your vessels, the heart has to work tougher. This reasons the walls of the coronary heart's pumping chamber to thicken, left ventricular hypertrophy. Ultimately, the thickened muscle may have a difficult time pumping sufficient blood to fulfill your body's wishes, which could cause heart failure. Weakened and narrowed blood vessels to your kidneys. This will save you those organs from functioning typically. Thickened, narrowed or torn blood vessels in the eyes. This will bring about vision loss. Metabolic Syndrome. This syndrome is a group of problems of your frame's metabolism, along with extended waist size, high triglycerides, reduced high-density lipoprotein, HDL, LDL cholesterol, the top, LDL cholesterol, excessive blood stress and high insulin ranges. These situations make you much more likely to develop diabetes, coronary heart disease and stroke. Problem with memory or knowledge. Out of control excessive blood pressure may affect your potential to think, remember and research. Hassle with memory or information standards is more common in people with excessive blood pressure. Dementia. Narrowed or blocked arteries can limit blood flow to the mind, leading to a positive form of dementia, vascular dementia. A stroke that interrupts blood drift to the brain can also purpose vascular dementia.